The Connections app is a telehealth-style program that allows those struggling with addiction to connect with mentors, health professionals, and others in recovery, all at the touch of a button.
You've got two things going on with this app. You've got national support from people who you don't have that history with, but you also have people who are trained, who are in recovery themselves, who have that additional little bit of training, who have walked in your shoes, but understand the professional aspects of recovery and the addiction model of the medical disease model.
IDOC is kicking off a pilot project that will help those struggling with substance abuse disorder have a support system right in their pocket. It's one of many telehealth options they're offering and will continue to offer even when the pandemic is over.
And we owe it to our offenders to teach them how to use this technology. We don't intend to go back as a department. We had the luxury because of a pandemic of doing a reset on how we do things.
It's a program IDOC says will likely make a big impact.
We do a substance use disorder assessment on everybody coming in. It's well over 90% have a history of substance use or active substance use at the time of their arrest.
For Jessica Holsey, her reason for wanting to support those struggling with addiction is personal.
I lost my parents to substance use disorder, but my mom, she went to prison as a result of her addiction, and I went into the foster care system. And sort of my role now to kind of help think of solutions on how we help people who are really struggling, I think is a great way to honor my mom.
Organizers say the pandemic has been especially hard on those struggling with substance abuse disorders.
Sort of isolation is a trigger and so difficult for individuals in recovery or seeking treatment. So to make these positive social interactions possible through technology, particularly during a pandemic that we're in, I think is incredibly important.
The Connections app is also available for those in recovery even after they leave the prison system in hopes of bringing the number of reoffenders down.
I think it can really be a game changer. And so we need to collect the data to make sure that, how we respond during the pandemic can and should inform how we improve services overall.
The pilot project went through several clinical trials before its launch. The rollout in Idaho is still in its early stages, so we don't have much in the way of local data just yet, but we'll be sure to keep you updated. For now, Natasha Williams, Idaho News 6.